Dr. Benjamin, you are having a party. No. I am having a party. No, no having party. I'm just coming here to be starting. Greetings to all my people. Greetings to everyone. Greetings to everyone tuned in the chat now. Tuned in the chat. As we all know, we are dealing with heart conditions. This is the week of heart conditions, and we are gonna do some things, ABCD, some ABCD, you know. We want to keep our hearts good. Uncle told me to tell him something. Now, everyone who is here, welcome. I can see Boss One. Greetings, Boss One. I can see Smile in the City. Welcome always to the chat. Welcome everyone to the chat. It's a good day that we have met again. And think, Uncle, yes, I've just started. Okay. And several questions have come up that we have tackled, and we have tried to tackle them. And you see, health matters are very complicated matters, but when you talk about health matters again, it means you are doing a good thing, because mentally, your mental health becomes well. And if you are watching, please, we enter as we like, because whatever that we are going to say is a good thing that helps people. So everyone who is here can see we are everyone who is here testing if sound is okay. Okay, the sound is okay. Now I can see we have some couple of people. We like and share and tell some people we are here. And it's very important we note that if someone can alert, Judy was interested in Judy was interested in this topic, and I think someone should alert her, because she's very committed to. Let me see if I can get her, so that she doesn't mean the main. Oh, Judy is here. Well, welcome, Judy. Yes, I was just about to call you. Now, what do we understand about rheumatism? Rheumatic heart disease, rheumatism. That is the question that we should be asking ourselves. It's very important when we ask ourselves some important question like, what is rheumatism? Why do some people have rheumatism and others do not? You see, those are the special questions that we should be asking ourselves and try to answer, because you see some very many complications occur, and then you start asking yourself, why me? Why? Why only me? Why am I the one suffering this thing? You see, there are some complications. Okay, I'm trying to find something here. Yes, there are some complications that most of the time maybe are genetic, but there are some complications that most of the time they come in life as per what? How can I say? What we are exposed to, or what we get out here. Now, before we continue on this topic called rheumatism, there is a very important thing that we really need to know. We really need to know some things that I want us to get to know. First, we need to know how the body fights diseases. It is a very important session to know that how the body fights diseases. And everyone knows the body has cells. We have cells like the erythrocytes, the red blood cells, and the white blood cells. But you see, the work of erythrocytes, which is the red blood cells, its work is to transport oxygen, transport oxygen. But we have other types of white blood cells. White blood cells are several types. White blood cells are several types, and we are interested in the white blood cells. What does white blood cells do? Because when you talk about cells of the body, of the blood, let's say cells of the blood is composed of several things like red blood cells, the erythrocytes, and then we have the white blood cells, we call them the leukocytes, you get it? And then we have platelets, we have several cytokines, yeah? Like this video as you join. Thanks a lot, Smile in the City. Thanks for that. Now, what we have, let's concentrate on the immune function. The immune function. What is the immune function of a person? Immune function of a person. It is very important we deal with the immunity of a person. Now, I don't know if you'll watch here, but I see I write in big letters. Now, white blood cells. White blood cells. They are composed of several types. We have the neutrophils. These are cells. White blood cells are not just cells. You get it? There are several types of white blood cells. We have the neutrophils, we have the lymphocytes, we have the monocytes, we have, let's write down neutrophils, and then we have the lymphocytes. And then we have another one, which is the monocytes. They are called the monocytes. And then we have something called, yes, as you come in, please, like we have eosinophils. We have eosinophils. Eosinophils. Types of white blood cells. And then we have basophils. All these types of cells, they have their own work that they do. We have the neutrophils, we have the basophils, we have so the red blood cells. Margie, welcome to the platform. As you can see what I've written at the board. We have neutrophils, we have lymphocytes, we have monocytes, we have basophils, we have eosinophils. These are types of white blood cells, and they have several things that they do. I want us to study about white blood cells so that when I go to rheumatic heart disease, you will not be confused about this. There are some things we need to know, the smaller things. Now, what are the neutrophils as white blood cells? These ones are in the blood. Yeah? They are the first responders to infection, quickly move to infection site and engulf and destroy the bacteria and the fungus. Sometimes you can be sick and then you just come out okay. You are sick, you feel sick. Hello, my sister Margaret. Welcome to the platform. I'm happy to see you here. Thanks a lot of tuning in, Margaret in Norway. Now, neutrophils. Sometimes I was explaining, sometimes you can be sick and then you just turn out to be okay all of a sudden. What is happening is your body immunity is helping you to fight the problems. You see, like the cells like the neutrophils, their work is to engulf and destroy. Engulfing is like, you see, sometimes you can, these cells, we say this is a neutrophil, so, and this is a bacteria. When you are sick, the bacteria is flowing in your body. It comes around this bacteria and engulfs it. It surrounds it and engulfs it, and then it removes some chemicals and they kill the bacteria naturally. You get it? They kill the bacteria naturally. And then we have, so this process of engulfing is called phagocytosis. It phagocytes. It takes it and then it kills it naturally. You get it? Now, we have another process, another cell, which is the lymphocytes. But your blood, the white blood cell, your blood, these ones are the more, neutrophils are more in your blood because of the function that I have told you, because of that function that I have told you. And then we have something else called the lymphocytes. These ones, they produce antibodies that target specific pathogens. Lymphocytes, they are several. We have the B lymphocytes. We have, with the lymphocytes, we have the B lymphocytes, we have the T lymphocytes, and we have the natural killer cells. The natural killer cells, they are called NK. You see, so these ones, they produce antibodies. I will tell you what antibodies are. And then we have the other ones. We have the other ones, which are the T cells. What the T cells do, they destroy infected or abnormal cells that help regulate immune response in your body. These ones, T cells, if your cells are infected, and they are becoming abnormal in your body, this white blood cell that is called the lymphocyte, which is the T cell, it destroys that cells. It destroys cells infected. And then we have natural killer cells. These ones, they act on natural killer cells. They act on cancer, viral cells, virus infected cells. They just go to those cells that are infected with the virus, and then they destroy them. This one, viral infected cells. They destroy viral infected cells. And then we have the other one, which is, I think you are following. We have started the topic on rheumatism. It is important you follow up so that you can understand this simple. Hilda, Uncle Blessing, love, and respect. We have the monocytes. These ones, monocytes, their work is to clean. They circulate through the body, they move into tissues and become macrophages. These cells engulf pathogen, dead cells, and debris. So when your cells are dead, the T cells have destroyed infected cells. Now, what comes in? Your blood cannot be dirty with dead cells. They come here, the monocytes. You see how we are going? Very nice and very smooth. We started by the neutrophils. You get it? That tell your body now, wake up, friends, wake up. There is a bad person running around. And then the lymphocytes, they wake up. So when the lymphocytes wake up, what happens? What happens is this. Just a minute, I come. Just a minute. Now, where were we, my friends? We were at the white blood cells. Now, the neutrophil, you are infected with a bacteria or a virus or a fungus. What happens? The neutrophils tell the lymphocytes, hey, lymphocytes, we have a stranger in the blood. Please wake up. Let's go fighting. Now, the strangers, the lymphocytes wake up and start detecting the strangers. Who is a bacteria, a virus, or a fungus? Now, these lymphocytes, they are different. We have B lymphocytes, we have T lymphocytes, and the natural killer cells. So what happens at this position? What happens is this. Sorry, trying to find how. Yes, like that. Now the B lymphocytes, they do what? They copy. They are the antibodies. They wake up. I'll explain what the antibodies do. Yeah? Produce antibodies that target specific pathogens. What does the antibodies do? Antibodies, they mimic the bacteria. They mimic the bacteria like this. If this is the bacteria, the antibodies mimic the bacteria so that they can learn how to fight the antibodies in your body, so that they can learn how to fight the bacteria which is targeting your body. You see that? And then after the antibodies have started working on how we can fight this antibody, yes, the T lymphocytes are working. The T lymphocytes are working. These are white blood cells. They come out and they say what? Let's destroy the infected cells. We have cells that are already infected. What can we do? Let's destroy them. We don't want infected cells because they will infect others. When they have destroyed the infected cells, now your blood cannot be that. Your blood cannot be dirty. Here comes the these ones, they come the natural killer cells. You see, natural killer cells attack viruses. Attack viruses, and what they do is they destroy the virus, just as the T lymphocytes. Then, if your blood cannot be dirty, what do we do? It should be cleaned up by something. Here comes the monocytes. Monocytes. Yeah? They clear them and they engulf the pathogen and dead cells and debris, and it destroys them, and they take the pathogens out through the liver, the process we call detoxification. You get it? Before you go to urinate or you go to the long call. And then we have something called the eosinophils. This one, eosinophils. Fight parasites and play a role in allergies. So when you have an allergy and you are coughing, welcome Barbara, welcome Herbs and Spice Boss One in the house. Please, let's Hilda there, Hilda Taylor, welcome Mercy Grace, welcome to the platform. Today we are talking about rheumatism, rheumatic heart disease. But before we talk about rheumatic heart disease, we should know about the cells of our body, especially the white blood cells. And we are at the eosinophils. Eosinophils, their purpose is to fight parasites, malaria parasite, you understand? Because now these ones are not micro bacteria like the fungus, they are bigger than, so they fight this. And in allergies, when you have an allergy of dust, everything, this is what makes you get inflammation. Inflammation. It is the one which makes you congest. It is the one which makes you have rashes, eosinophil. But it is through helping your body not to be destroyed. Now, we have another one called the basophil. Therefore, inflammation. They release histamine. Remember when we talked about the hay fever? Someone told us that she had hay fever, and then we discussed it, and then I explained about the basophil. Help trigger inflammation and assist in defending against infections. You get it? Now, there is something important I want us to learn. The topic of the day, as everyone understood about white blood cells? Say yes. Okay, everyone has understood. If you are coming in now you know you don't have only white blood cells that are only only a white blood cell. Now you know you have several types of white blood cell. Now we continue our topic and discussion, which is so good. But I welcome people first before we start the topic. This one was just an overview, but it will help us. Now, we have in the platform, we have Smile in the City, Boss One, all the moderators, welcome. Welcome, welcome, welcome. I also usually, good morning, Dr. Benjamin. Rheumatism is a disease that causes pain, stiffness in joints, muscles, or fibrous tissue. Yes, but now that one you're talking about is rheumatoid arthritis. Rheumatism is a broad spectrum word. Hilda Taylor, welcome to the platform. We adore you so much. Hilda Taylor must be a health worker. If you are not a general practitioner, you should be a nurse, physiotherapist, or so. I guess so. You should be working in a hospital. Marjay B, welcome to the platform. If you are coming in right now, please a thumb, man. Give me a like. Marjay B, Jamaican uncle is here watching, but he cannot comment. So don't ask where he is. He's kind of like working something out. J. King Ray, Judy, our sister here, who is Elsa, Margaret in Norway, always my sister, my charming sister from Kenya. Good, welcome, Smile in the City. You are always a great person. Now, Herbs and Spice, our sister from another mother, from another planet, another country. Welcome, Barbara. Barbara, nice. I sang for you a praise and worship song in Kiganda. I think I did not sing my things. I sang as the way you sing in church. Yes. Let's continue. Let's continue, my people. Now, the topic of today is rheumatism. What is Barbara, you are laughing. Okay. I hope I didn't sing my confusion. Now, the topic of today is rheumatic heart disease, which is under rheumatism. Rheumatism is a broad spectrum word to mean a cascade of diseases. Now, let's talk about rheumatism and rheumatic heart disease. What is rheumatism? We want to know how we get this disease called rheumatic fever. You see, rheumatic fever is the disease now. Rheumatic fever is the disease. And how do we get the rheumatic disease? Let's get to know how we get rheumatic disease. We should know first how we get diseases before we start helping. You know, you cannot have a problem without knowing where it came from. You should know where the problem came from first. Then you start working on it. And you see, I've said rheumatism is a cascade of diseases. It is not just one. Now, let's get to the boat or to the bus or to the train and we start rolling. Our driver today is who? Is the teacher himself, doctor. Now you understand this. We have been walking, getting flus everywhere. Supermarkets, in church, in everywhere, we start having a sore throat. And then that sore throat is from a bacteria called Streptococcus pyogenes. It doesn't depend when or where, but it may be when you are young. You get it. The time frame we don't know, but you got something called as a bacteria that causes a strep throat, and it is called Streptococcus pyogenes. This is now our culprit. This one, Streptococcus pyogenes, is our culprit. This is the one which is making us have problems. Now, you got a sore throat and it healed. But you see, let me make it easy before I go deep. We make it easy a bit and then we go hard. Now, the first step is we have got a sore throat, and this bacteria is the one which is causing a sore throat. Strep throat infection, body produces some antibodies. Remember what produces some antibodies? You remember what we talked about that time about antibodies? The body produces some antibodies, B lymphocytes. Eh? The cells, the white blood cells, which are the B lymphocytes now, they produce some antibodies. We're going to see which antibodies. Now, when the body has produced the antibodies, eh, what happens? Eh? Due to molecular mimicry, antibodies attack. Now, listen, I've said it is important you understand this topic slowly by slowly, so that you can understand how we have different types of what? Rheumatism. You get it? It is very important. Let me check this out. Let me check. I check if my streaming is okay. So, my friends, if you are coming in now, we are discussing rheumatic heart disease, but we started by discussing heart complications. Heart complications. Saying this one. We discussed cells of the white blood cells of the body. If you have not liked, please don't just watch. Like and share to someone you think it can help. You see, it is very important to share. Kind of like finding something. Yeah. Yes, yeah. Okay, let's continue. Now, the molecular mimicry, I've said the work of the B lymphocytes when they produce antibodies is this. You see, if this bacteria is like this, a triangle, the 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 B lymphocytes will change. They'll come out and change and form something like this, so that they start mimic. They start knowing how to fight. They start knowing how to fight this bacteria. So your antibodies trying to, but as they like this, if they shape up as the bacteria, what will happen? Now they will the mimicry, because it's not a bacteria but it's acting like a bacteria, they will start attacking your body. They will start attacking your body because they are mimicking what? They are mimicking the bacteria itself, our culprit Streptococcus pyogenes. And where does it attack? It attacks the heart, it attacks the joint, it attacks the skin, and also some places in your brain. You check it out. Very interesting, eh? The B lymphocytes are the culprit. You see why I started with the white blood cells? The B lymphocytes are the culprit. They shape up as the bacteria to start knowing how to fight it, and then they start attacking you because now they have gained the structure of the bacteria and they want to work like the bacteria so that they can help the body to fight. So they start attacking you, and the main places is the heart, the joints, the skin, and brain. You see that? Now, major features. What are the major features in rheumatic heart disease or rheumatism? What are the major features of rheumatism? First, I'm going faster so that we can understand the process. Then we go slow by slow. The major features are carditis. Carditis. What is carditis? The heart. Anytime you hear something called carditis, you know that we are talking about the heart. Carditis. And remember, if you have a question, don't leave it to yourself. Flow it to the chat panel so that we can go deep into it. Carditis refers to inflammation. Carditis. What is carditis? What is carditis? What is carditis? Carditis. What is carditis? Inflammation. Carditis is inflammation of the heart muscles. And the heart muscles are how many types? 3. Endo, the muscle of inside. This muscle that you are seeing here, let me turn this way. These muscles you are seeing here, This muscle you are seeing here, I want you to see it well. Okay. This muscle you are seeing here, it has the endo inside layer, and then we have there are several myo, which is the muscle, the heart muscle itself, and then we have peri, which is outside. Yeah. So if you hear about carditis, you know it is the inflammation of the heart muscles inside, beneath, and outside. So inside is endocarditis, outside is called myocarditis, and in between is called muscle. The muscle is called myocarditis, and then outside is called peri. All the three layers, pericarditis. You see, this one is the first feature, the pericarditis. And then we have something we call migratory polyarthritis. Migratory polyarthritis. And that polyarthritis comes why? Because we have seen you got an infection in your throat, and then it ended up to start attacking to form antibodies. This lymphocyte, the B lymphocytes, the cell that mimic the bacteria to know how to fight it, it got to a way it formed like a bacteria, and then it started attacking your body, which is, that one is called autoimmunity. Yeah? It is trying to help you, but at times it starts to fight you again. You see? And then we have chorea. People say it is chorea. We have seen carditis, we have seen chorea. Involuntary movements of your muscle. Sometimes you are just seated with people and then you do this. Sometimes you are seated with people and then you do this. You see, accessory muscles, the accessory nerve. You remember when I talked about the cranial nerves? Ophthalmic, optic, oculomotor, trochlear, trigeminal, abducens, facial, glossopharyngeal, hypoglossal, vagus nerve number 10, and then we went to accessory nerve. You remember those? Now, that one, the accessory nerve is the one which makes you, so when it is irritated, you have the strep and it's irritating, the antibodies have come and they are irritating that nerve. You will see people doing this sometimes. You are seated with a person and then this person does this. If you ask that person, what are you doing? That person is not aware because it is involuntary. It is involuntary. And then we have something called, we have Betty's World. I see you. Thanks a lot. Thanks for coming. Erythema maginata. Erythema maginata. A rash, you get a rash, a red rash that comes in your skin. It is called erythema maginata. So the other thing is subcutaneous nodules, some nodules in your hard nodules in your skin. So the major features we have talked about is, we have talked about carditis, inflammation of your heart muscles. We have talked about migratory polyarthritis, and the arthritis, I've said how it comes. The B lymphocyte is the culprit, but it's helping your body, and as it helps your body, it is destroying your joints. You understand? So you feel pain, and then chorea. Those are in Kenya. They will say this is sounding like chorea. No, it is called chorea. So my people, after you get this chorea, you get a rash, which is called erythema maginata, and then some nodules, hard nodules. But these are the major features. When someone gets rheumatism or rheumatoid arthritis, or this we call rheumatic heart disease, the first signs you will get are this: carditis, chorea, involuntary movement due to destruction of the accessory muscle, erythema marginatum, the rash that I've talked about, and then there are subcutaneous nodules on your skin. Subcutaneously, you get some rash in your skin. So if you have not liked, please like my topic. Like, if you have a question you've not understood, please just ask. Don't be afraid. I am able to explain and explain much further as you want. Now, there are some things called minor criteria, like having a fever. That one can be there because you are undergoing inflammation and the body is getting the heat and it is burning. Joint pains, even in malaria, you can get joint pains. These ones are minor criteria. Joint pains, elevated, when you go and do a lab test, you get CRP is raised, or ESR, erythrocyte sedimentation rate is raised, and a prolonged interval of ECG. We talked about ECG, but I'll come here and explain about ECG and how they work. Those are minor criteria. But there is an important question we need to ask ourselves. Now, I hope everyone has understood about what can treat the joint pain. Yes, I answered that, Betty, but I talked about it even yesterday, but I repeat it, what can treat the joint pain. The major criteria, when you see someone with this, 1, 2, 3, 4, there are 5. Migratory polyarthritis, large joints. That one is another one. Migratory. There are the major things that you really need to follow up. Please don't watch if you have not liked. It helps to make people come in and learn. Those that have not received the notification, when you like, it improves the notification process. So please just like as we continue. So when you have, you get your child or a big person has this, an adult has carditis, inflammation, a doctor tells you that chorea, involuntary movement of muscles without knowing. Someone is just moving, coming back, and you ask this person, what are you doing? He's not aware. Erythema marginatum, the rash on the skin that comes and goes. And then subcutaneous nodules. Nodules are some nodules, black and hard. And sometimes migratory arthritis. Migratory arthritis means from your back, you're feeling pain, from your joints, from everywhere. Know that maybe you may be dealing with streptococcus infection, sore throat infection of a streptococcus, the culprit that we have said. And these one are the major things that start in your body. They are the major things that makes you do what? Know that you may be having rheumatism. Yes, we continue. Who does it affect? It affects children between 5 to 15 years. So if you are not immunized well and you are exposed, you may start having this problem from childhood. Commonly in low setting areas. People say in Africa is common because, most of the world think that Africa is backward a bit. But me, I'll say nowadays it is everywhere. You get it? It is everywhere. Now, up to there, I think everyone is okay and knowing that that is the first process of getting rheumatoid arthritis. The things I've explained about the I went through the white blood cells because I really wanted people to know the function of this. And you see, we have measured down to the B lymphocytes, which is the white blood cell, that mimic the process of the bacteria. And then the antibodies which are produced by the B lymphocytes, they start to attack your body, and that is what makes you feel the pain. They start to attack your body, which is called autoimmunity. So let's continue. Very important. Now let's go to rheumatic heart disease. What is rheumatic heart disease? Rheumatic heart disease is a chronic complication. It is not just a complication, it is a condition of the heart, but a chronic complication of rheumatic fever, of rheumatic fever causing permanent valve damage. You get it? That was a very good explanation. It causes first what? Let me turn to this heart. Or we can use this one. This one is the better one. Let me turn to this one. Yes. The first thing it does, I want us to go so slowly and I explain. It destroys the heart valves, the pulmonary valve, the tricuspid valve, you get it? The mitral valve, the aortic valves, and we will see how it destroys the heart valves. You get it? We will see how it destroys the heart valves. Minute, okay. Now, we have said, it is a chronic complication of rheumatic fever causing permanent heart valve destruction. Now, when you get repeated or severe rheumatic fever, I will check the other pathophysiology. Wait a minute. Okay. You get repeated problems with streptococcus infection you're getting several sore throats that are coming and going. That streptococcus pyogenes, it leaves a toxin in your body that is called anti-streptomycin O. And the toxin, when the bacteria is gone, the toxin is the one which continues to destroy you. Anti-streptomycin O. You get it? When you take drugs and partially you kill the bacteria, it goes. Now, we have talked about the autoimmunity with the B lymphocytes producing antibodies and the sites where you are infected. Now, in the heart, we have said it involves the pericardia, causing pericarditis, inflammation of the heart muscles. Healing leads to fibrosis and scarring. You see, when these heart muscles they got, which name can I use? They are exposed to a bacteria like streptococcus. As it eats it, and then your body fights it or you get healed, it leaves fibrous tissue that cannot relax or expand well. So that is called fibrous tissue. A fibrous tissue that cannot expand or contract well. It is a hard place somewhere in the muscle. You get it? Now, the fibrosis or scarring, even when, let me say, you yourself, you have injured yourself. Let me use that word. You have injured or have a scratch. When a place heals, you will see a hard thing. That hard thing is what I'm calling fibrous tissue, a fibrotic tissue, a fibrous tissue. Healing leads to fibrosis, thickened, calcified, deformed place that cannot contract or relax well. These heart muscles does not need something that is fibrous. You get it? Results is rheumatic heart disease because of the fibrosis, and permanent heart valves because these valves are so soft, and the bacteria need soft and nutritious elements in the heart where they can eat and get oxygen. So they come at the valves where blood passes. So the commonly affected places are mitral valves. You see, tricuspid, mitral. Now, these mitral valves, where oxygen comes in. You see, this is the oxygenated blood that goes, but oxygen comes in from this side. So they like it there because they get oxygen, they get tissues that are soft, and they eat. So this happens in this way. mitral stenosis. It forms something called mitral stenosis. The valve becomes thick and short. So let's say this is the valve, and this one is the other one. It becomes like this. So this valve is thick and it is not moving well as it is. Like here, if you can form, imagine this valve being something like this, leafy. And then the aortic valve, the same. And when you have the bacteria have ate this place and they have formed a fibrous, they are thick and fibrous. You see, they cannot be moving so well as it is, because when blood goes like this, look at my fingers, it is supposed to be, when blood is coming, it is closed. When it is going down, it is open like this. They behave like this. You get? But now, when it is like they have formed a fibrous tissue after they are injured with the bacteria, fibrous tissue, now the relaxation and becomes so hard because they are thick and round. You get it? And what happens? Now blood starts forming, coming back. When the muscle of the heart, the pericardium, contracts. You remember depolarization and repolarization. So when it is depolarized and it pushes, what happens? Some blood comes back here, because these valves cannot pass blood as it is needed. Look at my fingers, my friends. This is the normal valve at here. So blood has come, it is filled, it opens, it comes in from the left ventricle, it closes again, waits to fill, it comes and... But now, when it has been affected, I've given an example of your cut somewhere and it has healed. You will get a scar there. You will get a scar when you are cut. And then some cuts, you will find that the scar is bigger than the normal skin. That is what happens in this place. Now you will find those valves are looking like this. Like this. So opening and closing becomes a problem. So when the muscle pushes blood, it becomes a problem. Why? Because it will regurgitate. It will come back. The process is called aortic stenosis or regurgitation. This is called aortic stenosis. Stenosis means constriction and becoming small, and then regurgitation means blood coming back. Blood coming, as if this is pushing to the blood is coming back. Fish mouth appearance. You see, they form something called, I wish I had a picture of a person that has done a rheumatic. It is called fish mouth appearance, because fish is like this. Let me get a picture. Anytime you go to hospital and then you are told your person has, the heart has a fish mouth appearance, just know they are talking about rheumatic heart disease. Now, check at this. Our fish looks like this. Normal fish. So, our heart, the valves are looking like this when they are having a problem. This is, now they have got fibrous tissue. So this one cannot hold blood, and it will be making, most of the time they affect mitral valves because it is rich in oxygen and they have nutrients, because they are used to push blood that is oxygenated. So mitral stenosis comes with fish blood. You feel it's like fish mouth, even here. So blood comes back to the right ventricle. And then we have several types of distraction. Because now you get streptococcus infection, it leaves something called an streptomycin O. It leaves something called streptomycin O. It's a toxin that is in your blood. Maybe you got that problem when you are young, and you've seen it comes from people from 5 years to 15 years. And then you were treated and it went, or your body fought the bacteria and it went, but it left a toxin called streptomycin O, which is still surrounding your body. And as it surrounds your body, the B lymphocytes that we have learned, the B lymphocytes, are still mimicking it because it's associating from streptococcus. So your body continuously gets on attacking your body, because the B lymphocytes now forget that your body, they start attacking your body because they have mimicked the bacteria. So after they have mimicked the bacteria, the process goes on. They are trying to mimic the bacteria to know how to fight them by helping the NK, natural killer cells, and then the others, the natural killer cells, and the T lymphocytes. The T lymphocytes, which destroys the bacteria, but they are doing harm by repeatedly destroying your body. Now, the mitral valves are destroyed. We get mitral regurgitation, blood coming, instead of going to the outer and going to the system, because the valves cannot hold blood, the blood is coming back to the left ventricle. You get it? Aortic regurgitation. That is called aortic regurgitation. And what are the features that you can get on this problem? We have talked about the features. The features we have talked about. A minute. One, we have said carditis, inflammation of the heart muscles. You see, after you get it at 5 years, you have gone around, you are not getting better, it's still piling. You go with it, and then you are 15, 20, 25, the process is still continuing. People are saying you are always weak. You go to the hospital, you are given antibiotics, the B lymphocytes are still mimicking the bacteria and producing the same effect. You see, if me, let me put myself now, I'm the B lymphocytes. I've woken up and I have taken position of, I want to go to the enemy, to fight to the enemy camp. I act like them so that I can know their weaknesses, so that I can fight them. Now I'm the B lymphocyte. After I do that, I am coming back and I'm behaving like the enemy themselves, and I'm fighting my people. That is how the B lymphocyte does. It awakens, forms antibodies to mimic the bacteria, to know how to fight it. But after it has mimicked the bacteria, it starts fighting your joints, your heart, forming pericarditis, and this is with the time. You get it? Eh? So you have migratory fever because it's an infection. Eh? Every time fever goes, fever comes, because it's a fight within your body. And then chest pain, always chest pain, because the heart muscles are having a problem. Central chest pain. These heart muscles have fibrous layers that have healed, but they are not pushing blood as it is needed. And remember, as if these muscles does not push blood as it is needed, what will happen? The outer, at the left coronary artery, that brings the coronary artery, carotid artery, that brings blood back to the heart to serve it, it will not have enough blood. You get it? So you will find that there is a problem with the heart. It is not getting enough oxygen. The muscles of the heart are not getting enough oxygen. So what will happen? Pain, because the heart will start, you get it? Chest pain. And then we have syndhychoria, a very funny word. Syndhychoria. Syndhychoria are involuntary movements that I've said. You are seated with people and you are doing, or so when people ask you, what are you doing? Is there a problem? You are not aware you are doing that because it is an involuntary problem. Your nerves have been affected. Yeah? The involuntary process, the accessory muscle is affected by that toxin that the bacteria left and it's been living in your body for long. So when it is affected, you start moving involuntary. Yeah? But remember, There are some things that are still happening within the B lymphocytes, the other cells, the eosinophils and the basophils, they are still working. So you will always be getting a rash that is going and coming, because the eosinophils, as they produce something called basophil, as they produce histamines, it is burning your skin and you get a rash. Check that out. So those are the major clinical features. In chronic rheumatic heart disease, now, because we are in the heart, and Hilda Taylor, I think you have understood how the pain comes in, how you get joint pains, how you get, even in other arthritis, how you get the joint pains that you usually get, and then you undergo inflammatory response. You now know how you get the pain. The B lymphocytes and the antibodies that are produced are the ones which are making people who have rheumatism, arthritis, rheumatic positive arthritis, the pain. You get it? But this one that is acquired, like rheumatic heart disease, it's still the same. The antibodies that mimic, and then they start fighting your body. That is called autoimmunity. The disease went and it has left a toxin plus the basophils that are helping you to mimic the sawa-sawa. Sawa-sawa means it's okay, we continue. Sawa-sawa, so when I say sawa-sawa, you say yes, we continue. Now, rheumatic heart disease, you'll find some people have, when the process has gone for so long, it's been 5 years you have not been treated well, it's been 10 years you've not been treated well, what will happen? You will have shortness of breath. You will have shortness of breath. You get it? Shortness of breath will be there. Why? Why shortness of breath? This heart is not pushing blood the way, the oxygenated blood from this side, the way it is needed. So the amount of red blood cells that are carrying oxygen, most of them do not reach tissues to give oxygen. So they remain here because we have regurgitation here. This valve is not doing its work. These mitral valves are not doing its work. They have fish mouth like this, so they cannot close well. So some blood comes back here. So oxygen carrying blood cells like red blood cells cannot go to the system and deliver oxygen as needed. If this muscle is pushing 200, 300, let's say 400, or let's say 500 red blood cells, and that is enough to give you energy because of oxygen. Now it is pushing and 300 are left behind because this one cannot close. Happy new month, Dr. Benjamin and everyone. Happy new month. Beauty, welcome. Welcome as we continue. So this one is returning the other cells, and the cells that are going is between 150 and so you lack oxygen. It is called hypoxia, physiological hypoxia. Your cells are not getting enough oxygen. You get it? Shortness of breath. That is where it starts. Your body is always tired. You get fatigue, palpitations, the chest, because the muscles are not getting enough oxygen. It starts to vibrate, to have, so you feel palpitations, chest pain is there. That one I've said. And then you have swelling of the legs. Everyone who has heart failure, you will find that their legs are retaining fluids. And then there is something that is called, yes, very important. You see, Kingsley is saying it happened to her few days after delivery. We will explain why it happened few days after delivery. It's very important. Now, there are some signs that are seen to show that this person, please, if you are having any question, don't fail to ask. This is a very important discussion, And you can help someone when this child is still young. When this child is still at 5 years, 4 years, 6 years, instead of this child growing up and destroying the heart and living with a permanent damage. If you have a question, please ask. Now, there are some signs when you get a stethoscope, the stethoscope that we put, and the one that I was with yesterday, and some people became so, eh, you remember? Some people became so, and I had to put it away. So, because some people don't like hospitals, when they see products of the hospital, they feel they are kind of like, yes. Now, mitral stenosis, diastolic murmur. You will feel these valves sometimes, they are doing what? These valves at times, they have murmur. When you listen with a stethoscope, you feel them doing. Why? Because they cannot hold to each other. So as blood goes, it remains with a vibration. So it's like a flute. You know, when a flute, you push air inside it by vibrating. So because the tension is has changed, it is small and it's vibrating. So you have a murmur inside. Yeah. Mitral regurgitation, holocystic murmur. Yeah. When the blood is going, when this one has pushed, when it comes back, some blood comes back. So you will hear a sound when you put on a stethoscope that is, when it pushes, you hear, because some blood is coming back. You get it? And then you will have irregular pulse because the sinoatrial node, our sinoatrial node, is not getting enough oxygen. It's not being coordinated. You get it? Those ones are called fibrillations. The heart will have a pulse that is so high to make sure that you are having enough oxygen. And that one is tachycardia, high heartbeat, tachycardia. And that one is sign of heart failure. So this is when you go to a hospital. You are advised to do something called an ECG. An ECG, you remember, is the electrocardiogram that we talked, and you saw it produces some waves, and I tried to explain about these waves, the P waves. You remember on heart conduction? If you don't remember, please just go through it. It shows that you have those. It will show us atrial fibrillations. You see why I started with the conduction of the heart? You remember atrial fibrillations? Fibrillations are heartbeats that are so fast before the heart collapses. You remember the sound that I was saying before, pa, 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 fibrillations. Yeah? And then you will find left atrial enlargement. Left atrial enlargement. You get it? Why? Because most of the blood here is not going, it is left here. So the muscles do a lot of work until they are enlarged. They are enlarged. So you go to a hospital, you do an ECG to confirm about the fibrillations and the tachycardias. You do a chest X-ray. You will find an enlarged heart. Enlarged heart with pulmonary congestion. This one here. You'll find this place has a lot of blood that is not even being taken, some of it. So the heart is kind of like enlarged. And sometimes you'll see people with, if you check at the X-ray, you will find it's like seated like a boot, because this side is enlarged and this side is enlarged. You get it? Because of the congestion, pulmonary congestion. So there is some important blood work that we do. We call it ASOT. ASOT is called anti-streptococcal or assault. We call it assault. Anti-streptomycin, or tatias. This streptomycin is the toxin that I've said. This bacteria called Streptococcus pyogenes lives in your body, and it continuously destroys your body as the antibodies are mimicking it. You check that out. That is the bacteria. So if it is within the normal range is okay. But if it is with more than 200 microliters up, we say that that is so much and you are suffering from rheumatism now. And if you have the heart symptoms that I've said, now we say that if you have the regurgitation, you have the chest pain, you have the mitral murmurs, we say that you are having rheumatic heart disease. And you know what? There are some conditions that there are some complications of the rheumatic heart disease. Okay, I've talked so much. If you are listening and you have a question, let me give half a minute to hear if someone, if someone has a question, please ask. I'm giving half a minute. Anyone with a question? Anyone who feels he has a question before I continue? Okay, let me continue. If you have it, you are still typing, that is the best. Now, this condition of the heart, there are some complications that you can get them forever. Heart failure. We started by heart. This can cause the ankle to swell. Yes. You see, as the B lymphocytes are as the B lymphocytes are mimicking the bacteria and they are fighting your body, yes? Thanks, Uncle. As they are fighting your body, what happens is inflammation is going on. Your body is being attacked. B cell is being attacking your body, your tendons, your muscles, so they have to swell. And when you touch where the tendon, the ankles, and the joints are, you will feel that they are warm. That's why you swell. Sometimes people say that I feel I'm not sick, but my ankles are just warm and swelling. Now you know, if you don't have a fever and you have ankles that are swelling, you have an autoimmune disease, which may be rheumatic heart failure, and the B lymphocytes are working, are mimicking. So the complications that we have is damaged valves. That one we have talked about, of the heart, which is leading to shortness of breath and swelling of the legs and fatigue, tiredness because of low oxygen. This is one of the common and dangerous outcomes, swelling of the legs. If knee pain is associated with a, is there a specific treatment? Yes, Kingre, there is a specific treatment and we are coming to it. Very important question. Now, we are talking about complications, the bad complications of this. Infective endocarditis, infection of the heart valves. More likely because damaged valves provide a surface for bacteria to attach. Yes, so sometimes when you have fever, it's not good to take something to stop it. When you have fever, just take paracetamol. It is important because it will reduce the inflammation, and it will, when you take paracetamol, it stops some products, some cytokines that are called prostaglandins. So prostaglandins are the ones which come out and they make the blood somewhere warm by increasing blood flow to that place, so that when blood flow goes to that place, all the mediators of inflammation come, the B lymphocyte, the monocyte, and then they start working on what has happened there. So when you take paracetamol, you stop it, that process, so you are relieved, even fever is gone down, and if it is inflammatory process making you feel pain, yes, paracetamol you can get it over the counter here in Kenya. I don't know about where you are, but paracetamol is an over the counter. It is an analgesic. It's a painkiller, antipyretic. That one you can get it over the counter. Yes, so infective endocarditis, destruction of the heart valves, can destroy valves and spread infection to other organs. Because now, if the heart valves are being destroyed, check it out. If these heart valves are being eaten, and there is where the blood is flowing, going to the system, what happens? The blood can carry the bacteria that are eating this to take to the body. It can carry and take it to the body. You get it? And then there is a very bad thing that can happen to you. Atrial fibrillations. We started by you remember our introduction of cardiology. We started by sinoatrial tachycardia, sinus tachycardia, and when we went to the other one, which was we went to, you remember? Then we went to, and then after that, we went to fibrillations, and then you get it. So it goes like that. If you have not got the introduction, please go to the intro. Focal, we started with sinus tachycardia, focal atrial tachycardia. Then we went to, after focal atrial tachycardia, we went to arterial fibrillation. After arterial fibrillations, we went to arterial flutter. After arterial flutter, we went to AVRT. It's quite common. You can get yes, smile in the city. That is quite common. So when we get to fibrillations, it is an abnormal irregular heartbeat. Happens due to enlargement of the heart chambers, increased risk of blood clot. Because fibrillations are beating so fast, even blood is not passing as it is needed. And then you can get stroke. Blood clots formed in the heart, often from fibrillation. Heart that is beating like this, blood is not flowing in there, can travel to the brain. This blocks, you see, when you get the fibrillation and then you get a clot, it can travel to the brain and then it blocks the brain vessels, causing a stroke, which can lead to paralysis and death. Pulmonary hypertension. I've talked about it somewhere about pulmonary, and I explained. The sixth one, you can get valve damages. That one I've talked about. Valve damages that are regurgitating and risking stenosis, constriction, and becoming small, making your veins not to perform as they are. Stenosis, becoming smaller. So those are, sometimes I don't like talking about sudden death because I like preserving life. So anywhere that there is a complication that is death, it means it's not a complication. You have not done your work as a doctor and death has come. So I don't like saying death. So those are the key points. And remember another thing, if bacteria can come to this heart and eat the septal place, the septum is this, and eat this septum, this one here between, they can eat it until there is a hole at the septum. So it means as this heart is pushing blood, some blood will be mixing. The blood from this side will be mixing with the blood from this side. We call them atrioseptal defects. Septal defects, atrioseptal defects. So when this blood is mixing with the blood to this side, you don't have enough blood going systemically, because as this one is pumping, some blood is coming this side. As this one is pumping, some blood is coming. So the outer is not receiving enough blood to go to the body to pump. That is where there is something called TET spell. TET spell is where when you have attacks, you are standing. When you have attacks and you are standing, you feel dizzy. What you can do is you sit like this. When you sit like this, you feel better. Why? You feel better because when you lie down like this, now this one gets the energy to push blood. But when you are standing, it doesn't get enough energy to push blood to the body. It affects, so this one is like the one that affects children that are born. We talked, Jamaican uncle brought a topic about a hole in the heart. It affects those children a lot. But you see, this one is acquired. You got a bacteria and it has eaten the septum until there is a hole. Complications of the heart. So it is important if you are having chronic fevers, if you are having chronic joint pains and you're just taking painkillers and relaxing, please visit a physician, visit a hospital, a health worker. Ask these health workers to do something called ASOT, antistreptomycin or tatire, to get to see if you still have a toxin of that bacteria in your blood, so that it can start being managed. You see now, every part of acquired arthritis, as I started, that is how it starts. Leave alone other arthritis that we call like gout arthritis, like because gout arthritis, of course, the B lymphocytes comes in, but you see, this one is a problem with some uric acid. The one that is called osteogenic arthritis, osteogenic imperfectus, those ones are different. This one is pathologic. So when we bend and we stand up fast and feel dizzy, that is what causes that. No, well, you see, that is another kind of physiological function. This one, I'm talking about a person who has a septum hole. The bacteria has eaten this, has become so thin until it has got a hole. But when you wake up and you feel dizzy, that one is balance. Vestibulocochlear. Yesterday I talked about the cranial nerve. You remember? Ophthalmic, optic, facial, those. There is one called vestibulocochlear, which helps the hearing and balance of your body. So when you lie down and you stand up so fast, before it gains the position, you start feeling dizzy. Yes, Jamaican uncle. Yes, that's your channel. Yes, you start feeling dizzy. You get it? That is another thing, a nerve complication of balance that does not give you chance. You feel dizzy and then when you're okay. But this one is a pathologic process that the bacteria have eaten this septum until you have a hole inside. And the blood, which is oxygenated, is mixing with deoxygenated blood. You get it? That is totally different. Now we understand why when you lie down and you wake up so fast, you understand. Now, we continue to investigations and treatment. Rheumatic fever. Streptococcus is the main culprit, is the main bacteria. So what do we do here? Have you ever heard of the children that are born and they are given a certain injection up to 18 years, sorry. They are given a strong penicillin, a concentrated penicillin, not a strong. I don't like using strong. A concentrated penicillin that is called penicillin G. Panada 2.4, and there is one that is 4.5. Those are the drugs that come and help this person. You get it? And then you are given, for an adult, you'll be given this until the repeat of the test. Most of the time it is given within 6 months to 1 year for adults, or 1 year and a half according to your doctor. And then you repeat the assault-titer test, the toxin. There is another one called anti-inflammatories, aspirins and NSAIDs, to stop some things called prostaglandins and the B lymphocytes to continue attacking your body and causing inflammation. NSAIDs. But I don't like using diclofenac so much. It has an issue when it comes to prolonged use with your kidney. It can make you have acute kidney injury. So people that are used to diclofenacs every time, you'll be concerned. I'm concerned about that. I better use prednisone alone. 2.4 is what I'm using monthly. Okay. J. Kingray, we are so sorry you acquired this when you are young, but I'll find time one day we meet. I check you out. That one I'll find time. We see where you are, and I can at least advise. So 2.4 is given for 6 months to 2 years for adults. For children, it is up to 18 years. The work of that is works as a prophylaxis of no any other infection can come to destroy you, and it helps when it comes to clearance of the streptomycin or toxin that the bacteria left some years ago. You get it? And then we have echocardiography, best for valve damages. You check the echocardiography, you check these valves to check if it is destroyed. You can put a stent, a plastic stent that can act as a valve to pass blood and do the same thing as the valve is doing. For arrhythmias, when you have arrhythmias, we have several things you can do. Some people use pacemakers. If the sinoatrial nodes are really destroyed and your ventricles are not working correctly, you get it? That one is what you can. Please, if you're coming now, don't forget to give me a like, and don't forget to ask me a question. If you have a question, don't forget to ask me a question. I'm here to be asked question and to interact so that we can know how we can continue. You see, helping people. I will meet Judy one day and at least know how she's going on and where she is right now, and if she has some symptoms that are alarming. So we have talked about chest X-ray. Chest X-ray is important because it will show you how the heart is and which side is really destroyed, which muscles of the ventricles are really destroyed. Because if this side it is so enlarged, you will see in a chest X-ray a very light place that is so big, and you will know the right ventricle has a problem. Now we talk about rheumatic fever. That one we've talked about rheumatic heart disease, rheumatic fever by treatment of penicillin. That one, even one of us has said she's on it. Anti-inflammatories to reduce the inflammation, and severe carditis. You see, carditis, when this one is having fibrosis, the heart is having fibrosis. When the heart is having fibrosis and it is not receiving enough oxygen because the coronary vein that is coming has attained stenosis, you will feel pain. So to release this, not to have continuous constriction, you can use a corticosteroid, a steroid to reduce the pain. So when this one has relieved and they are relaxed, you will not feel the central pain. When the ventricles muscles have relaxed, you will not feel the central pain. Now, we have rheumatic heart disease Now the pressure, because all this that is happening, you may get that your BPs, blood pressures are going high because sometimes the ventricles are beating so high. The heart, so, and the constricted veins, you remember, like stenosis of the vessels that come out of the heart. You need some diuretics. Diuretics are like furosemide, and there are some diuretic like spironolactone. What they do, they release excess water from the heart and the body. So the heart will have, that is when you are given, sometimes when you give those diuretics to some people, they really go to the loo so much. They really urinate. You get, to release enough fluid so that the heart can pump well, and the legs that are swollen to relieve enough more fluids. Anticoagulants, those people that have fibrillations causing clottings. Fibrillations are heartbeats that are so high and beating so fast. We give them anticoagulants not to get blood clots. And then we have, for the heart valves that are destroyed, we give valves repair. We repair them. Or we can give some stents that we cut them and you put a plastic one that does the same work as the valve. You get it? So there are some things you can do in life by primary preventing it. Treat strep throat early with antibiotics. Never ignore a strep throat. When you are feeling irritation, you have a flu, and you are feeling irritation around your throat, never ignore that. Never ignore a strep throat. You get it? It may be the first step of you having rheumatic heart disease. So for those that have got it, they have long-term on benzathine penicillin injection, the way I've explained, because of the streptomycin or toxin from the bacteria that a person got. And then we have pre- preventing. Use masks sometimes when you're going, people who have in hospitals. That's why children are not allowed. When you go with the children with a child to visit someone in a hospital, there are some places they cannot. You are told, leave your child here. You will come to pick your child after you have seen someone because of hospital acquired strep infection. This is why. Get it? Hmm? It is important to note that, and it's very important to know that this one can be avoided, and rheumatic heart disease has caused a lot of problems, causing people to have arthritis acquired that they did not expect to have. Hmm? So there are some things that you details things that we will talk about there, but they are so molecular. Those ones, one day I'll just make a video. If you want detailed information, the one that I've said is not a detailed one, because there is something called molecular basis, whereby we have some things like Ascoff bodies, the cells. We have how the valvular fibrosis happen, mitral valves, and then we have the M protein. M protein that is being copied by the antibodies from the bacteria itself, how they copy and they start attacking the body. That one I'll put a video, and it will not be live, so that someone can move about it slowly if you are interested. Now, anyone with a question, it has been a long talk and a very long story. Anyone who feels the question now, there's a question. Let me go through the questions. I think I've answered all the questions correctly. And it is quite important to note that some diseases can be avoided as long as you follow the public health protocol. In every country, the WHO has protocols in health matters in every country. So check out every protocol in your country about social issues and interaction in hospitals and interaction out there. So anyone who has a question up to there, anyone who has a question before we finish, and I think that we have dealt with the treatment so well because um, if it is inflammation, we have given corticosteroids. Because now, with the inflammation, the corticosteroids that are there like prednisolone, and you give with paracetamol. For adults, we give like 20 to 30 milligrams of prednisolone if it is bad for the start. With paracetamol, 1 gram. 1 gram is 2 tablets of 500. In children trying to digest, Betty, Betty has listened and heard and is quite feeling that we are living in a world full of problems. Well, you may ask yourself. There is a question I know why what people are asking themselves. There are some people who are asking themselves, why do some people get this problem and some people don't get the problem? This one is a combination. As you discuss, let me come, please. Let me relieve myself. I come. Just don't move. Continue asking, and I'm coming. I will be coming just right now. Don't move. Now for that test. Smile in the city. You want to go and do that test? Let's talk about why some people get it and some people don't get it. Just bear with me as I'm going outside and coming. You understand what is happening. I'm still at work and I'm giving a talk. So there are some genetic susceptibility, genetic. Some people are genetically predisposed. Their immune system react abnormally strongly to streptococcus. Hazel, greetings everyone in the chat. Happy new month. Happy new month, Hazel. Some people react funny with them. Others have they most likely to develop this acute rheumatic fever because of their immune system. Eh? They progress to rheumatic heart disease because of their immunity. They react, the B cells and the monocytes and what, those cells that I started with, they react so fast. Yes, genetic, smile in the city. You get it? This explains why two children get the same sore throat and one develops rheumatic heart disease, because in your family, you have a a very strong reaction. The B cells, which are the lymphocytes, the B cells, they react so fast. And then we have the other one, which is the just a minute. As you come in, please if you have a question, please ask. Let me, a second, I finish, I give some papers, I come. Those who are coming in, don't leave without giving me a like, please. Bring your questions. As I come, we deal with the questions that we'll be asking. Any question? Any question? Any question? I'm not seeing any question here. Not seeing any question. Okay, now I'm here. Hi, Benjamin, and everyone else on the live stream. Blessings, yes, blessings. Real classroom. Thank you, doctor. Thanks a lot for that. Sorry, I'm at work. I had to rush out a bit, but I'm back right now. So, we have talked about rheumatic heart disease, and I think Judy is still around. Judy, we will find one day we meet with you. I want to follow up on your case. Ali Mig TV, welcome to the platform. Although you have come as we are finishing, it's okay. You can like and share the talk, and I think we don't have questions. People have understood that there are some genetic mechanisms that people can have that they are predispose them to have this complication. So Judy, you have my number. We will talk. We will talk when we get time, and we see how we can help each other on that. And if you I wanted to know which drugs you are using, but it's okay. Don't worry about it. I will know with time. And there are some things. Number two, why people get and others don't get it. Like not all Streptococcus pyogenes strains are equal. There are several streptococcal strains that produce this. So some are not rheumatogenic, but this one that we have talked about, which is streptococcal pyogenes, it is bad. That one is rheumatogenic. It can produce those rheumatogenic. It excites B lymphocytes so much. Welcome, wow, welcome, wow. More likely to trigger autoimmune infections, the pyogenic. Another thing I've emphasized on is delayed or lack of treatment. If strep throat is not treated or it is treated late, please treat this. I will inbox you. Thanks for your concern. Thanks, Judy. Thanks, Judy. Early antibiotics, when people start on antibiotics, it prevents the disease. Johnny Be Good, welcome, welcome, welcome to the platform. So when you start having a sore throat, please go to a doctor. Don't say you are used to fever and flus. When you have a flu that is involving a strep throat, much of the children, make sure you give them drugs, antibiotics. You check me out. It is very important. And then we have environmental factors. Environmental factors that are, I forgot to give at here. Let me give a fact. Higher. Yes, as we finish, we are on environmental factors. Environmental factors can be a great deal when it comes to this problem. overcrowding living conditions. People are living a lot. You see, sometimes poverty makes people not to have no choice. You get people are living a lot on a slum or some congested places. So when a child gets this and they are playing together in congested, hey, Fasi, I mean, am I late? Fasi is coming as the talk is about to end, but it's okay. Fasi, you will rewatch and will be good. Just at least give me a like. At least we know you. And if you've not subscribed, you subscribe. I know you have subscribed. Now, low social economic settings because of the crowding. Why? It spreads the infection a lot. It spreads the infection a lot. Repeated infections increase immune sensitivity. So when you are repeatedly getting the infection, the cells that we have been talking about, these cells, these B lymphocytes, these mediators of immunity, what do? They start attacking your body at a higher rate. They start attacking your body at a higher rate. You get it? And it becomes a problem because you've seen the major thing that happens in rheumatism is the repeated attack of your body by antibodies from the B cells. You get it? So low economic infection, and then we have recurrent infections, repeated infections, repeated untreated strep infections. Train the immune system to overreact. Your immune system is always overreacting. And you see, we have said in white blood cells, the lymphocytes, the major one that produces antibodies is the B lymphocytes. This one, the B lymphocytes. As the B lymphocytes is producing the antibodies, the antibody starts to attack your body. It attacks your body, and that way is when you get inflammation around your knees, around your hands, around your ankles. You get it. That is the main problem that occurs. Repeated attacks. Chronic right rheumatic heart disease and left heart swelling of your heart. That is the problem. You get it? Immune system behavior. The main issue is molecular mimicry. And that one I'm still saying. The molecular mimicry, the B antibodies mimicking the bacteria, and then it starts to attack you. It starts to attack you. They mimic how when you get a bacteria, let me just repeat. When you get a bacteria, the lymphocytes, the B lymphocytes, which are the B lymphocytes, they want to be like the bacteria, they stay with them so that they can attack them. They can come and tell the others, this is how they behave, please go and attack them. And as they are like the bacteria, they forget and start attacking your body, other cells, because now they are working like the bacteria. Autoimmunity. You get it? They attack heart valves, joints, brains, forming the fibrous tissues. And fibrous tissues do not work well as the normal tissues. And then age factor. Age most occurs in children 5 to 15 years. Adults is less, but if you are an adult and you get rheumatism, just know it started when you were young. Just know it started when you were young. You get it? At last, you will always find that people that get rheumatic heart disease is because of predisposition, abnormal immune function, the B lymphocytes, virulent bacterial stains, delayed or no treatment, repeated infections in your body. That is why. You get it? I think today we have learned about rheumatism, and you've seen rheumatism as we speak. Rheumatism is a bacterial infection that turns to be. Please, if you are coming in right now, and check if you have liked. If you have not liked, just like and rewatch and share this information to any person who might have. Humble Marcia lifestyle. Welcome, Humble Marcia. even if you are finishing. You know right now how the problem comes. So any attack of any arthritis, it is the B lymphocytes that are operating in your body. It is the B lymphocytes. Yes, Marcia, you are late, but it's okay. You will rewatch. It is the B lymphocytes that mimics the bacteria. And if it is from streptococcus, if it is from streptococcus pyogenes, the mimicry and the toxin that the streptococcus leaves behind is what is destroying you. You get it? The mimicry, the B lymphocytes producing antibodies to start working as bacteria, to know how to work on you, but now it starts to do what? To fight you. And then the streptococcus, your body has fought the streptococcus bacteria, it has gone. What is left behind? What is left behind is the toxin. And the toxin is what which makes you to have the problem. You get it? Even you can start swelling. The pericardial layer of your heart, the layers of your heart can start having fluids that are piling, because of fibrous layer, because of the fibrous layer. So if you have ever told with anyone that you have fluid in your heart, what they mean is this. Let's check on this side, this heart. Please like my talk as we go. Please just give me like, because I would like more impressions, even to the people who are here and have channels. I would like them to have more more impressions. So this heart layer, if it gets a fibrous tissue in between here, and it stays for long, and then it stretches, you will start having the myocardial layer starting to pile fluids. So this part of the muscle will not be pushing blood as it is needed, because now it is having a particular pile of fluid, serous fluid. So it can be even pass, because if a fibrous tissue is eaten and then it is dying, in a case of something called myocardial infarction, you will get pus. So that is when you go to the hospital and they drain the pus and they give you the antibiotics we have said. So that is it concerning rheumatism, concerning rheumatic heart disease. Is there anyone who needs any talk about rheumatism or rheumatic heart disease, or something of arthritis? Arthritis, we'll talk about other types of arthritis when time comes, but right now you remember we are dealing with heart issues. Any question before I leave? 4 minutes remaining. Any question? Who has any question before I leave? Any question? Anyone who has a question? And any question before I leave? I'm waiting for any person who has any question, because I don't want to leave if a person has a question, and then next time when I come, the person will have forgotten the question, and then the person will tell me, I had a question, but I forgot asking. No. Any question? Okay, I'll say that is okay. Now, my people, if you have not liked as you rewatch, please like and share the video. If you have a topic that you really need us to talk about, if you have a topic, sorry, I missed out. Does having a large, yes, sorry, I missed out. Does having a large heart bad? Humble Marcia is asking, does having a large heart bad? My question will be, a person who is born with a normal large heart, or a person who was born with a normal heart, and now because of the problem it has become big? You know, this is true. If it was pathologic, if it was septic like in our condition, and then it had, I said it had an hypertrophy, then the right side became bigger, that is bad. That is bad because you will have problems. That ventricle will not be pumping blood as it is needed. So that is when you have fatigues, loss of the TET spells that I've said. Please watch this. You will understand how. But if you are born with a bigger heart that is functioning normally, that one is okay because there are some people who are born with bigger hearts, but physiologically they are okay. Everything is pumping okay, everything is pumping nice. But if you are born with a normal heart and because of a disease, it becomes big because of some issues, it means it's not good. You need to be rechecked and treated. I think that is it. I've answered that correctly. So, guys, if there is no any other person who has a question, I think there is someone who has a question. Anyone who has a question, please. Anyone who has a question? Let me wait. How many minutes? Oh, I have 2 minutes. Anyone who has a question? Oh, the cause of blood in urine. The cause of blood in urine. Blood in urine is called hematuria. Going to the loo and then you get blood. There are some very many causes of blood in urine. You get it? There are so many causes of blood in urine. A normal rupture can cause blood in urine. A normal rupture can cause blood in urine. A pathological process can cause blood in urine, like post-streptococcal glomerulonephritis. That is an infection of streptococcus in the kidney, and when you have healed, there are some scars that are left and you are bleeding. So when you go to the loo, you see some droplets and then there is something called where the position where you are bleeding from. You may be bleeding from the urethra, you may be bleeding from the bladder, you may be bleeding from the kidney, and then you urinate. You see, so it is the levels of where you are bleeding from, and it is very important to know. But see, thanks a lot. It's because I do research FRC. If you want to know more, the more you are studying, the more you are doing research, the more you kind of like know many things. Like in my case, I do many research. MTB, Pika Adventures. Welcome to the chat, MTB. And don't go without subscribing, MTB, and giving me a like too. Give me a like too as we talk. Now, it depends. You see, if you have an infection at the urethra, you can urinate blood after you heal because of the strictures. Strictures are places that have healed but are still damaged. Oh, MC, thank you so much. Thank you so much. Your like is appreciated. Thank you, thank you, thank you. And if you have a channel, please leave it. Anyone who is a moderator can share your channel here. So you see, so if it is at the kidney level, we call it and the infection is streptococcus. We call it post-streptococcus glomerulonephritis. And then there is something else called antibody immunity, like the one that we have talked about. Your antibody starts to fight the kidney, and then they swell. They call blood in urine after infections. We call it IgA nephropathy. You get it? Ali Mig TV, don't worry. This is just question time. You can watch other times. Miriam Mumbwa, greetings. Welcome, welcome, welcome. And then we have lupus, a disease like lupus, systemic lupus. That one is coming. We will discuss it. You get it? Rapid progressive glomerulonephritis is another disease. That question you've asked, it is coming as a big topic. Urine with blood. You see the things I'm naming? It is coming as a big topic because you need to understand from the kidneys, from the bladder, from the urethra. Infections, urinary tract infections, kidney stones, my friends, kidney stones. Kidney stones can cause flank pains and blood due to mucosal injury. The stones traveling through the mucosa of the kidneys causing bruises and you are urinating. You get it? The worst one being the tumors, cancers, kidney cancer and bladder cancer. Painless hematuриas in cancer. You are urinating blood because you have a kidney cancer. You get it? Sometimes you injury to the kidneys, that is trauma, injury to the kidneys, bladder and urethra. For men got prostates. When you get benign prostate hyperplasia or prostate cancer, you can have blood in kidney. The last one which people need do, and when they have, they don't know, usage of drugs. And I've said, usage of drugs like diclofenac, you use them acutely. Don't be using them every time, because NSAIDs, diclofenac, aspirin, brufen, they can cause an injury at your kidney, and then you will start having blood flowing with urine. Anticoagulants, those drugs that make your blood thin, like heparin, for those people who have been given due to thromboembolic diseases, clotting factors and clotting diseases. Warfarin, if you have those tablets, you can be taking them until you start urinating. Can kidney stone cause blood in urine? Yes, I've just said that. Smile in the city. I have just said that because of the bruising, as they cause injuries. I've said that. Exercise induced, seen in very intense exercise. Sometimes people go to the gym and they carry excessive weights. Then you start urinating. We will see. And there are so other causes like genetic causes like sickle cell disease. You've seen sickle cell disease, some people urinating with blood because of continuous destructions of red blood cells. And then we have schistosomiasis. In Kenya, people who live around a place called Mwea, there is something called schistosomiasis, the hematobium. When you drink the water and then you get those parasites in yourself, they go to the kidney and the blood, and you get blood in urine. And then blood in urine for women, sometimes you may confuse menstruation with the last one. So there are so many questions, but don't worry, that is a topic that is coming full swing. You'll get to know. So any question that I'm left with, I think Taylor, I've answered it correctly. At least you have some hints, but it is coming as a full 2 hours talk on urine in blood in urine. So if we don't have any other question, if you are coming late and you are here, don't forget to like my chat. Don't forget to like. We have so many videos on medical talks. If you are new here, you rewatch. I thank you so much, everyone. My gang, Miriam Mumbwa, Embassy Lipenga, Hilda Taylor, all that I cannot name, all in the Judy, Johnny Be Good, Jamaican Uncle as usual, Humble Marcia, Hazel, all of you that you've tuned in and we have talked, I thank you for tuning in. Please share the video and also don't forget to like. Tell someone if you have a question, check out Dr. Benjamin, Dr. Ben. I think I will leave it from there. We meet at 7 when we are seeing Uncle. So, guys, bye. Till we meet again. Today we don't have a talk tonight unless it comes random. If someone calls me and wants me to talk about something, I might come at 10. At 10, that is East African time. So, guys, have a blessed evening, those in Kenya and everyone. I love you all. Stay healthy and safe. Bye bye. See you later.